Hi students, it's Jamie. How's everybody doing today? Okay, this recording, I just wanted to talk to you a little bit about the endocrine system, chapter 25. Lots of students talked about being worried about this quiz, and so I just want to kind of take you through the endocrine module for a second. We are getting close to the end of this course, and this is our last quiz. And so I've given you some key directions to go towards, and I'll explain those. So basically, when we're looking at the endocrine system, it's either a deficiency in a hormone or too much of a hormone. And then how that clinically affects the patient and the feedback systems. And so really, if you can use charts or in some way when you're going through the material, if you can kind of compare it with each other, if one hormone is too much, considering if one hormone is too less, not enough, how does that change the effects? So, I think charts are really helpful. And for an example, I made a chart. Let me see if I can go back and pull it up for you. I made a chart for you on diabetes to kind of give you an idea of how you could create a chart. This is a chart that I actually use in the face-to-face class too when we're lecturing about diabetes. Hopefully it comes up. But if, for instance, diabetes, if you can compare type 1 to type 2, knowing the etiology, how is that different? What does it look like? How is it controlled? What are the signs and symptoms? So what are the signs and symptoms of diabetes for type 1 versus type 2? What types of tests are for each of them? And some of them, of course, are the same, but some of them are different. The treatment for diabetes 1 and diabetes 2, how is it treated different? Of course, the blood levels are the same. Kind of the complications. So if you make some notes on what are the complications of hypoglycemia versus when a diabetic doesn't have enough insulin for some reason, I think that will really help you. And so if you can make some charts with the different pathologies in this section and then comparing them, I think it'll really help you when you're studying. Also, I put on here so the PowerPoint for the whole chapter. And then these videos are really good. They're quick. I mean, you actually, if reading the book is just, you don't really want to read about Cushing disease, and you don't want to read about the difference between, ketoacidosis, you could watch these videos, and the same information is in these videos as well. But I put those there to help you. And what else did I put on there? I put in the beginning here, since quite a few people were worried about this quiz. Okay, I put 1 to 21 questions here. If you go through and you answer, and you can answer each of these 21 questions, you're going to do pretty good on this quiz. Wink, wink, nod, nod, big smile. So making sure that you can answer these. I pretty much looked at the quiz and made sure that there's a question over here that relates to the quiz. And just to point you in the right directions, because there's quite a bit in this chapter, but it's broken down. I like how this chapter breaks down each of the pathologies and compares, for instance, hyperthyroidism, Graves' disease with hypothyroidism. So again, there's an example where your book does a chart of how the symptoms are different, but you could make a chart to even show what happens in the body that's different. The growth hormone, of course, when we're talking about dwarfism or giantism, and how those two are different. So the pituitary tumors, Diabetes is a big one. There's quite a few questions on diabetes, to be honest, because this is something that you're going to work with a lot in physical therapy, and what you're working with as a PTA with diabetes is the effects of diabetes. So patients, lose the ability to feel their feet. They become tingly, they become numb, and so they're more susceptible for a pressure sore and breakdown, and then that breakdown doesn't heal, and then they get an amputation, and then that amputation doesn't heal, so then they have to go back into surgery and cut higher. And a lot of times a diabetic patient will lose one limb and will lose the other within 5 years because of their healing. Their healing is really compromised. Now, these are diabetics who are not controlling their blood sugars, have other pathologies going on as well. They're obese. Their body's not healing well. I don't want to. As an example, I have a student right now in my A&P class, a young 21-year-old that has diabetes, and when I lectured on diabetes, I just felt like, I could just see the life just kind of draining out of her eyes. Like, I don't want this to be me. I don't want this to be me. And I don't think it has to be her. I mean, she's active, she's fit, she takes care of herself, she eats well. So I'm not saying that all diabetic patients will get pressure ulcers and have amputations, but we're talking about the ones that we're going to see in as a PTA, and these are ones that have difficulty, and they're seeing us obviously because they have a reason. So we're working with diabetic patients to get them up and moving. We may be providing positioning so that they don't get further breakdown. We may be doing gait training and transfer training, which is a lot of what we do with diabetic patients who have had an amputation, because they need to relearn how to walk and move and use an assistive device. Not all diabetics get prosthetic limbs. In fact, it's not that common. Most diabetic patients don't get an artificial limb because of the healing and the possible pressure sore that could break down in the socket of a prosthetic. So I remember thinking that as a student when I first worked with a diabetic patient that had an amputation, and she'd had an amputation like 4 months before that, and I asked the PT, well, isn't she going to get an artificial limb? Isn't she going to get an artificial leg? And he said, well, not all patients want an artificial limb. Do you know how much energy that's going to require her to walk, to stand, to put on a leg? And I really hadn't thought about it in those terms. But not diabetic patients don't often get an artificial limb. So there's all sorts of things that go into a diabetic patient that really relate to physical therapy. So I think you'll see patients in this category a lot, especially with type 2 diabetes on the rise right now, with diabetes, with obesity. I think you're going to see that. So anyway, these are the key questions. You study these questions, you read the book, you take some good notes, you work yourself through this module. You're going to be okay on the quiz. I didn't put anything on that quiz that's overly technical in terms of not the pathology, but more like the physiology of some of these things. I really didn't put those processes in there because what's most important, and for the licensure exam, is that you know these endocrine system disorders. You know what they are. You know it's either a lack or an excess of which hormone, how that affects the body, and their signs and symptoms, and the treatment. So that's how I made the quiz pertain. It's the facts that I'm looking for here, not the big physiology. So I hope that helps. Now, before you take the quiz, if you want to talk it through with me, you want to just tell me what you know over the phone or in an email, and I'll say, yes, you've got it, you can do it. If you need that sounding board, please feel free to use me for that, because it just seems like a lot of students are worried about this quiz, and I'm hoping I can relieve some of that Anxiety. Yes. So that is my comments for the endocrine system. And then the other thing is the mental disorders are on page 522 to 525 in your book. It's really light, you guys. It's only a couple of pages. I've added in some information from other sources because your book is so light on these. I picked the ones that are on the licensure exam, to be honest. As far as mental disorders. So this module should go really, really fast. You shouldn't have a problem with it. And the mental disorders assignment is very straightforward and I think pretty easy. So kind of a great way to end us out. What else do I want to say? A couple people had commented on, how am I going to remember all this? How am I going to study for the licensure exam? But what I would, and how am I going to remember pathology? I wish there was a lab portion to this class. And I want to tell you that pathology doesn't have a lab per se right now, but you're going to hit it again. For instance, when we talk about endocrine disorders and diabetes, for instance, when we get into PTA 227, which I teach that to you in the spring, and it has a lab class to it, one of the pathologies that I'm teaching you is how to work with a diabetic patient and positioning with a diabetic patient. So all of these things that you've learned in pathology, you get to see in a procedures class, and we take it to the next step. For instance, the respiratory disorders, that seemed pretty huge. But we're going to hit it again. And what happens is in special topics, which is at the very end of your program, it's a really fun lab class. And it's all about the lab. So we talk about cystic fibrosis again, and this time you learn chest physical therapy, you learn chest PT, you practice it on each other. We talk about COPD in terms of positioning and walking with a patient. We bring up the heart patient again. And so even though it seems like, wow, this is a lot of information, I don't think I'm going to remember it, I want you to just hang on and trust me and know that it comes up again. For instance, cardiovascular, we're going to talk about heart patients and transfers in that special topics class. You're going to go to a cardiac rehab center and you're going to get to actually trail along with an actual cardiac patient as they have all the leads on and they're working on the treadmill. You get to stand there and talk with them and work with them. So all of these things that you learn in pathology do come up again in another class. Mental disorders and like dementia actually come up again in 227 because I'm going to show you how do you take a dementia patient who can't communicate, doesn't really want to do something with you. How do you get them? I mean, they've had a hip fracture and you need to get them up and moving with a walker. Oh my gosh, how do you do that? I'm going to teach you. We're going to teach you how you do that, how you work with patients who have dementia or short-term or long-term memory deficits. So if you can just trust me and know that you're just getting the foundation down, you're just getting the first scaffolding down of pathology, but then it all applies in the procedures classes and we take it a step further. I think you guys are all doing great and you're right where you need to be, and I'm loving teaching you on the other end here, and I hope that if you're having trouble with anything that you just email me or call me. I'd love to talk with you. So hang in there, you guys. You're almost to the end. I'm going to go ahead and open up these the rest of the class, and hopefully that won't panic anyone. I know that we have a student who's anxiously waiting an arrival of a baby, and I think he would appreciate the opportunity to work ahead just a little bit, so when those nights come that he gets no sleep and him and his wife are up, maybe he could work ahead. And maybe there's some of you you, for instance, that are going to be gone on Thanksgiving, or you'd just like to plain turn off the computer for a couple days, I want you to be able to work ahead too. So I'm going to go ahead and open up the rest of the class. Doesn't mean that you have to work ahead, and I don't want to give anyone anxiety at the same time. I just want to leave it open in case there are some of you that just want to get it done, or you want to take more time on the endocrine system because you are worried about that quiz or whatever. I want you to be able to do that. So I'm going to open it up, and all right, you guys have a good night. Bye.